Welcome to my new episode, Amenorrhea and Terminologies. Mainly, amenorrhea is the absence of menses in reproductive age. Hypomenorrhea is menstrual cycle is scanty or there is spotting. Oligomenorrhea, increase in the duration of menstrual cycle more than 35 days. Hypooligomenorrhea is it is scanty and small in duration. Menorrhagia, it is a cyclical menstrual bleeding, heavy in amount and duration or both. Polymenorrhea, it means the duration is less than 21 days. Menometrorrhea is irregular cycle, either it is continuous, spotting, heavy or sometime lighter. So there is no regularity, it is irregular, so it is known as menometrorrhea. Amenorrhea is, as we talked about, it is the absence of menstruation. There are types, either it is true amenorrhea or it is cryptomenorrhea. Because cryptomenorrhea means false amenorrhea, there is menses, there is cycle is going on, but it is not obvious. True amenorrhea may be due to physiological cause, pathological cause may be primary or secondary. Now, first is cryptomenorrhea, mean hidden. There is physical obstruction in the lower part of the genital tract. The menstrual blood does not escape out of the vagina due to either congenital abnormality or concealed menstruation. The causes are as a result of abnormality during embryological life, imperforated hymen, vaginal septum, non-canalization or absence of vagina, that is very rare. Blockage of cervix may be congenital or acquired. The first and the commonest cause of cryptomenorrhea is imperforated hymen. When development happens, there is a half moon of a thin membrane normally surround the opening of a young girl's vagina. In case of imperforated hymen, this membrane extends all the way across the area of the hymen, blocking the vaginal opening. Due to the vaginal blockage, menstruation happens, but there is no flow. This happens, patient can come with a history of pain in lower abdomen, cyclical pain, but there is no bleeding. The other cause is vaginal septum. Vaginal septum is either due to abnormal embryological development of urogenital system. The incidence is between 1 to 4,000 to 1 to 10,000. This is due to failure of vertical fusion defect or failure in the fusion of the Mullerian system with the urogenital sinus, incomplete canalization of the vagina. The septum may be transverse or longitudinal. There are different levels, either it is higher, mid position or low position. Transverse septums are the importance due to outflow obstruction. There is a cryptomenorrhea. But the other problem related to this is it may lead to hematocorpus or hematometra. This septum, the higher is the highest number, 46%, middle is 35% and lower is 19%. All these blockage, menses will happen, collection of blood is behind and it is not obvious and patient will have cryptomenorrhea. Vaginal absence is very rare, but there is non-canalization as a result of non-canalization or absence of vagina. The upper part is intact. Uterus is under the influence of hypothalamus, ovary and pituitary, and it is forming the layer. Endometrial is growing and shading, but because the passage is not there, so it will accumulate behind. Cryptomenorrhea, another cause. This is the blockage of cervix, or it is due to stenosis. Stenosis is maybe congenital or acquired, or any surgery done, or there is ablation, or there is cervical or uterine cancer, radiation therapy. It causes stenosis and usually it is asymptomatic. Hematocolpus, as a result of vaginal septum due to congenital blockage in the lower vagina, normal menstrual blood accumulate and build up in the upper vagina. Vagina will sac with blood, fill with blood, and blood become thick, dark, chocolate color, and water will absorb and they will give appearance hematocolpus. When the patient will come to you, she is complaining there is no menses, periodic pain in the lower abdomen, and this pain is cyclical pain because the time when the menses happen, and when it become increase in size, it can cause retention of urine. Patients, if you examine the patient develops secondary sexual characteristic. On examination, you can see there is dark bluish membrane. It may be imperforated hymen or septum in the vagina. Prolonged cryptomenorrhea, as the blood is accumulating, cause palpable mass. Or if you can do a rectal examination, you will find a mass is occupying the whole pelvis. The investigation and this photo, as you are seeing, is scan done and you found this hematocolpus. Hematometra, when it increase reaches to the uterus, is accumulate in the uterine cavity, may be due to prolonged cryptomenorrhea or due to atresia of the cervix. Hematosalpinx, as a result of hematocolpus, hematometra, it end up in hematosalpinx. The treatment of all these, in case of imperforated hymen, you have to do cruciform incision and the blood will start draining and woman will have or girl will have regular cycle. If there is atresia or vaginal absence, then patient will refer to a special center and they will do vaginoplasty. Surgical removal of septum, when it is lower or middle, it can easily done, but if it is higher, then double approach is done through vagina and laparoscopy. If the reason is stenosed cervix, then dilatation of cervix will help. During the procedure, prophylactic antibiotic should be given, and because of all these causes, girls are very upset. Proper psychological counseling is must for them. Feel free to like or subscribe my channel so you will see the new videos. Write a comment or any question or any topic you want to see next, write in the comment box.